Hi, welcome to another episode of Youth Diary. When we think about the common illness in our society, the two common problems that come to our mind are diabetes and hypertension. So today we are going to discuss about diabetes. In simple words, I can say diabetes is a group of metabolic diseases in which a person has a high blood glucose level. Let's find more about diabetes. So today we have Dr. Pradeep Sreedhar with us. He is a diabetologist from Calicut. Hello doctor, welcome to our show.
Thank you.
When we talk about diabetes, it is one of the common problems that's seen in all age groups. So can you just explain me what is a diabetes and what is the incidence of diabetes?
Diabetes is a metabolic disorder affecting the beta cells of the pancreas, whereby there is destruction of the beta cells and thereby the patient has very low insulin levels in the body, which is insufficient to maintain a good glycemic control. And if you talk about incidence, there are two types, type 1 and type 2. We talk about type 1 diabetes. The incidence, actually it's about 5% in a child if one parent is diabetic, and it's about 15% if both the parents are diabetic.
Okay. Doctor, our young friends have got a few doubts about diabetes. Let's watch that.
Hi ma'am, I'm Jaswin. I'm working in Dublin Healthcare. Can you please tell me about the early onset of diabetes in the younger generation?
Yeah, as I said, early onset of diabetes. So diabetes is basically two types, it's type 1 and type 2. So type 1 diabetes is what you see in even at birth or maybe at a very early age before adolescence. Whereas type 2 is something, earlier we used to see type 2 only beyond 40 years of age, but now we do see type 2 at much earlier age, around 20-25 years, because of various lifestyle changes and dietary habits, etc. So when you talk about early onset of diabetes, in type 1 the basic problem is an autoimmune destruction of the beta cells of the pancreas. So thereby the patient has absolutely no insulin in the body, the child, So he'll have to be on insulin therapy lifetime. So when you talk about type 2 diabetes, again, there are various reasons why the early onset, prematurity at birth itself is a major factor, which you notice because babies born premature are prone to become diabetic at a much earlier age.
That's in type 2. Type 2 diabetes. Okay.
Yeah.
And in type 1 you said, sir, doctor, that is in a much early age group.
Yeah, type 1 is again autoimmune destruction of the pancreatic cells.
Usually
so that happens at birth or maybe at the early infancy.
Since birth the child is...
can be diabetic, at early infancy, before adolescence. But type 2 appears a little later in life. So type 2 again, as I said, premature babies later in life, they become, there's a good chance of becoming diabetic. And then of course dietary habits, obesity is a major factor. Obese children, they are prone to become diabetic at a later age. Dietary habits, children who are actually eating more of carbohydrate food like ice creams, chocolates, they all are prone to become diabetic.
For type 2.
Type 2. Regular exercises is very important. So those children who are, nowadays you see most of them sitting in front of the television most of the time.
Sedentary.
Absolutely. So they spend more time in front of the television, and that's the time they eat more, kind of binge eating. They consume all aerated and harmful food, which again predispose them to diabetes at a much earlier age group.
So in this, which type is more common?
Type 2 is more common. Type 1 is not that common. Of course, as I said, it's much less, but type 2 is more common nowadays. And we do see type 2 at a much earlier age group now. That is what is more alarming. Because earlier days, we don't even think of a patient becoming diabetic beyond earlier than 40 years. But now the whole scenario has changed. Now we do see type 2 at much 25 years.
So does a lifestyle affect this?
Of course, lifestyle. That's why I said, it's mainly because the lifestyle changes. Children don't exercise. They eat all kind of junk food. They spend most of the time in front of the television. They don't go out and play. And then apart from that, there are various other factors also. As I said, there are certain rare causes which can also lead to type 2 diabetes in later age, like maturity onset diabetes in young. Various other reasons also. Cystic fibrosis is one thing. Children with Down syndrome are prone to have diabetes at a later age. Those are all rarer causes, but I'm saying mostly the main causes are again the lifestyle change.
So doctor, we'll move on to the next question.
Yeah.
Hi ma'am, I am Ajesh Matthew, working in Down Healthcare, Leela in Proper Kakna. Could you please explain what are the complications of diabetes in younger age group?
See, when you talk about the complications of diabetes, we have to say both the acute as well as the chronic complications. So if you're talking about younger age group, it's more the acute complications that are predominant here. So when you talk about type 1 diabetes, the commonest complication that we encounter is diabetic ketoacidosis, which is a very life-threatening problem, medical emergency, which has to be tackled immediately. There again, there's absolutely no insulin in type 1, there's no insulin left in the body. So you may go into a ketotic state, which can even be very dangerous to. And another thing is about acute emergency is a hyperglycemic hyperosmolar state. That is again more common in type 2 diabetes. The management is again, you have to, for in ketoacidosis, you have to be supplementing with adequate hydration, adequate parenteral insulin therapy. You have to supplement electrolyte correction, like potassium replacement, bicarbonate therapy. These are the main things which you need to correct such an acute emergency situation. But again, if you talk about the chronic complications, we all know diabetes is a disease which can affect most of the target organs in the body, like the heart, the kidney, the eye, the nervous system. So the most commonest complication what you see is about diabetic cardiovascular disease, diabetic eye disease, or diabetic retinopathy. When it affects the kidney, it's diabetic nephropathy, and then the nervous system is affected, it is diabetic neuropathy. And then you have autonomic neuropathy again, it's a problem. Sexual dysfunction is a problem in diabetes. Foot problems, it's very common nowadays. We see
they get ulcers.
Foot ulcers, diabetic foot ulcers is very common. And then we do get a lot of skin problems in diabetes. Gastrointestinal problems in diabetes, it's a very common thing.
I think it affects most of the organs in our body.
Mostly all the organs, and primarily those target organs, which are the heart, the kidney, the eye, and the nervous system. And then of course other organs also, even the joints are affected. Rheumatic disorders in diabetes is also quite common.
So doctor, you have already talked about the complications, but let me ask you something. What are the symptoms of diabetes?
Symptoms, the usual triad of symptoms, like they call you polyuria, polyphagia, polydipsia. So polyuria means is infrequent urination. Polydipsia is increased thirst, and polyphagia is increased appetite. These are the commonest complications that you notice in the initial stages of diabetes. Then of course you see a lot of weight loss, fatigue. These are the common things which you encounter.
So it is always better to get their blood test or urine test done when they have at least any of these.
Yeah, of course. These are actually the kind of markers, the signals they give you. So they, when you find such symptoms, it's always better, and especially if you have the patient has a family history of diabetes, his parents are diabetic, and he's in that particular age group where he's prone to be diabetic. So in such situations, when you have such symptoms, it is always better to go in for a periodic blood sugar estimation.
Doctor, we'll move on to the next question.
Hi ma'am, my name is Marcus. I work at Dublin Healthcare, and I want to know the relationship between sexual dysfunction and diabetes.
Sexual dysfunction in diabetes again is a very common problem which we encounter. We do see that in men as well as in women. It's not sexual dysfunction in men alone, but men is more predominant actually. Women, we do see in women, but not to the extent to which we see in men. So when let me tell you about the problems that you see in women. The commonest sexual problems that you see in women are lack of sexual desire or arousal, and then they have frequent fungal or candidal infections, and then menstrual irregularities are quite common, and dryness of the vagina. These are the common things which you see in females. Whereas in men, the commonest problem that you encounter is erectile dysfunction. So erectile dysfunction basically is a state where the patient is unable to attain erection as well as sustain erection. So that's the commonest thing which you see in sexual problem. Now if you ask the reasons for sexual dysfunction, there are various reasons which can lead to sexual dysfunction in a diabetic. Macrovascular disease is something which is very common. Microangiopathy is a common cause which can cause sexual dysfunction. Autonomic neuropathy is the most common problem which can cause sexual dysfunction. And then of course certain drugs, most of these patients are diabetic, may be hypertensive also. So there's a chance they may be taking multiple drugs for hypertension. Certain drugs, antihypertensives, they cause sexual dysfunction. And various reasons like that. These are the common things which I can. Hypogonadism is a reason again, so where the patient has decreased testosterone levels in the body, which is one of the reasons for sexual dysfunction.
So doctor, once the diabetes is corrected or once you have started the medication, can this problem be cured? I mean, not diabetes I'm asking about,
the sexual dysfunction. To a certain extent, yes. If you have a good glycemic control, if you maintain a good glycemic control, you can actually sexual dysfunction do improve to a certain extent. But apart from that, if there is a certain amount of damage which has already occurred to the blood vessels or the vascular system, so that needs its own kind of therapy. So we do have a lot of, first and foremost what I would say is to tackle this problem, the most important thing is a counseling, because there's a lot of it. You have to see whether it's a functional problem or an organic problem. So the functional element is much more predominant here in section.
So doctor, we'll move to the next question.
Hello ma'am, I'm Jasna. I'm working with Dublin Healthcare. Could you please explain me about effects of diabetes during pregnancy in younger age group?
Diabetes in pregnancy. Okay. See, when you talk about diabetes in pregnancy, you need to talk about two things. One is the gestational diabetes, and the other is the pre-gestational diabetes.
Gestational means I think only during.
During pregnancy. Various hormonal changes occurring in the mother during that pregnancy period. They're prone to develop diabetes, but that usually lasts only for during that pregnancy, and most of them with labor. They cease to become.
It will disappear.
Disappear. Whereas pre-gestational diabetes is a different entity altogether. That's something which is more alarming. And the patient is already a diabetic, and then goes into pregnancy, and she has to go through that period uneventful. So that is something which requires more problems. Gestational diabetes, during that period, if you maintain a glycemic status well under control, most of the pregnancy goes uneventful, and but in the other situation, they've been diabetic for a longer period, or at least few years before pregnancy, and then they would have already had few diabetic complications set in already, and then they go into pregnancy. So that's a stage when you have to be very more careful.
Conscious. And you talked about gestational diabetes, doctor. So can it be controlled with diet alone, or do they need some medication?
Clear guideline, or I would say ADA, American Diabetes Association, has recommended clear guideline for monitoring the glycemic status in a pregnant mother. So if it is maintained well within those guidelines, it is okay. The patient can actually continue through pregnancy, purely on diet and lifestyle modifications. But what is more important is, they have to be very periodically monitoring their blood sugars. I would recommend at least 2 or 3 times a day self-glucose monitoring system, which is, you can have a glucometer at home. And if they find any abnormal value, they should immediately start off with insulin. And here insulin is the drug of choice actually, rather than oral hypoglycemic agents.
Doctor, you talked about the self-monitoring method,
Yeah.
the glucometer.
Okay.
Can you just have a few words on glucometer? How does it, how can we use that glucometer?
It's a very simple device actually, which is used, it's just a prick method which you use on your fingertip, and just a drop of blood, the capillary blood, which is put onto the glucometer, and within a minute you get the reading there. So it gives you a fairly good...
so you mean to say that it's a handy machine?
Very much. I would recommend all patients should carry at least one of them while traveling, because that gives you a clear idea. It may not be as accurate as a plasma glucose value.
Lab investigation.
Plasma glucose. But then this definitely gives you a fairly good idea about your glycemic status.
So according to that, we can modify our diet or...
Of course.
Okay. So when you talked about the type 1, or pre-gestational diabetes, I think the patient has to be under control before pregnancy, or...
No, pre-gestation is a situation where the patient is already diabetic before she becomes pregnant.
Okay.
So obviously she would have been on some medication, so she has to continue. But once she goes into the pregnancy, she has to be all the more careful. So she has to, her monitoring should be more frequent, and she should try to maintain her glycemic levels much below normal during that period, because it's a very the pregnancy period has to be under absolute control.
Will these changes, or will this diabetes, pre-gestational or diabetes, gestational diabetes, will it affect the baby?
Yeah, surely it will. If you don't have good glycemic control through your pregnancy, it can lead to serious problems in the newborn.
Okay.
So they say it's about twofold increase in congenital malformations. I'm talking about uncontrolled diabetes.
Okay.
Can cause about in pre-gestation, can cause about twofold increase in congenital malformations, about fourfold increase in perinatal mortality, about fivefold increase in stillbirths, and so it can even lead to various problems in the child. Macrosomia is a problem, stillbirth, perinatal mortality. So many problems can happen in the child if blood sugars are not well controlled during a pregnancy.
So Doctor, we'll move on to the next question.
Hello ma'am, I'm Sneha from Dublin Healthcare. Could you please explain me about lifestyle and diabetes?
She has asked about lifestyle and diabetes.
Yeah, most important, I would say, in this generation. So that's what we lack here. So diabetes occurs mainly because of poor lifestyle habits among the newer generation. So when you talk about lifestyle and diabetes, the most important thing is very frequent exercise schedule, which we lack among our younger generation now.
Very sedentary lifestyle.
Very sedentary lifestyle. They are more the time fixed in front of the computer or television. So they absolutely have no exercise pattern in their life. So that is something which has to be corrected at the earliest. And then of course diet. Most of the diet, kind of junk food, aerated food, all those things which can, cause diabetes at a much earlier, predisposed to diabetes at a much earlier age.
Doctor, we have got a mail. We'll move to that. I'm a 30-year-old businessman diagnosed to have diabetes at the age of 25 years. Both my parents are diabetic. I'm on regular oral medications. So I just want to know, what are the newer modalities other than oral medications?
Okay. See, if the person is on oral medications and if he is well controlled on oral medications, he's periodically monitoring his blood sugars, there is actually no need to switch on to any other modality of treatment.
Okay.
But then again, what he wanted to know is what are the other options other than oral medication.
I think he was talking about the device.
okay. Of course, insulin is the next option. Other than oral medication, insulin is what we recommend for uncontrolled diabetes. Now, if you want for administering insulin, there are newer gadgets which have come into market, like the insulin pens. This is basically for the convenience of the patient, because most of them have a phobia for insulin needles. So this is much more finer needle, and it's easier to carry around because you don't need much of refrigeration because insulin is inside.
So Doctor, you've explained very well about diabetes, symptoms and its management. I know it's such a short period to explain everything about diabetes, but it was so informative talk. Thank you so much, Doctor.
Thank you.
So guys, by this time all of you must have realized the importance of diet, exercise and proper medication. So patients' education, participation is vital. If you have any doubts, write to us. Our email ID is youthdiaryroseball@gmail.com.